everyone, this is Coach Nicola and I want to talk to you a little bit about starting to exercise after having your baby. Okay, so the general rule of thumb is 6 weeks postpartum, you can get started. Now, it's not quite as straightforward as that. Now, the reason why 6 weeks is kind of given as the marker is because generally that's when we have our postnatal checks with our GP. That's when the GP will ask how you're doing, will check on your baby. But the thing with that appointment is that GPs are not postnatal specialists, okay? So there are some things you really have to take into consideration before you start an exercise regime, all right? Now, 6 weeks is the marker for a normal vaginal delivery, and we recommend 10 to 12 week wait if you've had a C-section. Now, that's because a C-section is quite major abdominal surgery, okay? So everyone recovers at a different rate, and recovery will depend on things like if it was a scheduled C-section or if it was a emergency situation. Okay, so it's very much up to you. Even when you've seen the GP who've said, "Yep, go ahead and exercise," it's very much up to you to gauge how you are in your body. All right. Now, no matter what, it's really important to start really gradually and really steadily. You don't have to wait until 6 weeks before you start to exercise postnatally. It's really important to do general exercising through walking, stretching, and obviously you'll be exercising through taking care of yourself and your baby in your everyday life, okay? So you want to avoid being sedentary, you want to get off that couch, and you want to increase the amount that you're doing each day, all right? So perhaps getting a slightly longer walk each week, something like that. But generally at 6 weeks, that's when you can start thinking about doing a little bit more exercise. Things you need to take into consideration though, when you start on an exercise program, okay? Contraindications, so reasons to stop exercising. If you start and you do too much too soon, there are several things your body will do to let you know, okay? So one of those things is any new vaginal bleeding, all right? So once the postpartum bleeding has stopped, it should not come back until you get your first period, okay? So if you find that you start to bleed again after exercising, it means that you need to adjust the kind of exercise you're doing, the intensity of the exercise you're doing, and you need to rein it back, okay, and do some assessment about what's going on with your body. All right, secondly, pain, okay? Pain is a massive indicator for telling yourself to stop, all right? Pain means stop what you're doing, all right? Now, we do expect some discomfort during exercise, okay? But pain is a no-go. It's a way of your body telling you to stop, all right? So pain in the incision area, so where you've had your C-section, you shouldn't feel any pain there, or any area where you've had stitches, okay? So real sign that you need to take assessment of kind of exercise that you're doing and the intensity, all right? You need to modify the kind of exercise that you're taking part in. Also, muscle ache, okay? So we expect a certain amount of muscle ache after exercising, but sometimes it's difficult to tell the difference between a muscle ache and perhaps a joint pain or an injury, all right? So delayed onset muscle soreness tends to last a couple of days. So any kind of pain going on for more than 3 days, you do need to take into account and to perhaps look at, all right? So you also need to be really aware of any kind of change in your pelvic floor function. By that I mean, are you suffering from any urinary or fecal incontinence, okay? Is it difficult for you to get to the bathroom in time? If you sneeze or if you cough, do you find that you lose control of your pelvic floor function? Okay, they are indicators that you need to perhaps do some more lower impact exercise first. There can be lots of things you need to do to adjust that impact, okay? So that's definitely cause for more information, more investigation, but to stop the kind of exercise that you're doing and talk to somebody, okay? Further, any kind of pressure in your pelvic area can be a sign of pelvic organ prolapse, okay? And this is an area that not enough women talk about with their friends, with other mums, with their partner, or even with their doctor, okay? So what is a prolapse? A prolapse is when one of the pelvic floor organs pushes through an orifice in your pelvic floor area, okay? So it could be your vagina falling through, it could be your rectum falling through, okay? So obviously these are difficult conversations to have, but they're very, very important. What does that feel like? Okay, it's a sensation of a kind of dragging feeling, a kind of pulling down feeling. Some women have described it to me as feeling like they've got a tampon in, but they know they haven't, okay? This is a sign of major weakness in the pelvic floor function, and the pelvic floor muscles not working to hold up those pelvic organs, okay? It's not something you need to live with. It's not a reason to stop exercise forever. It just means we need to adjust the type of exercise you're doing and get some professional guidance on what exercises to do, what level your prolapse is at, okay? So this isn't just important for your immediate postpartum health. It's important for your long-term health as a woman, for your pelvic floor health. You see the adverts for women wearing tenor lady, as if that's just a thing we need to accept about getting older. Sorry, you're an older lady, you're going to have to wear incontinence pads. No, 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 all right? If you deal with any kind of incontinence or prolapse now, when you're younger, then you minimise the chances of needing help when you're older, when you're an older lady, okay? So, these things can happen to women whether they've had babies or not. All right, it is a case of hormones, of intensity, lifestyle, all of those things, okay? So don't think that having a baby means you can't jump on a trampoline ever again, that you can't go running, that you constantly need to be wearing some kind of pad. It's not true, all right? You can get help. If any of these issues apply to you, okay, as far as your pelvic floor health is concerned, please be in touch with me, okay? If I can't help you, I will put you in touch with a women's health physiotherapist who will be able to help you. They are specifically trained to work with these areas, okay? And there will be women's health physios local to you that I can recommend, okay? So use me as your first port of call, and if I can't help you, I can refer you on. It's really important you get the help that you need, okay? So, as well as having pelvic floor function as a thing to really think about and concentrate on, I also want to mention the tummy separation that a lot of us will have heard about, the diastasis recti, okay? That's a separation of the tummy muscles when the baby grows and your uterus pushes through with the growth of your uterus and your baby, okay? Happens to most women, okay? For some women, it will close naturally after birth, okay? For some, it won't. It will depend on the size of the baby, the strength of the abdominals before and after, genetics, all sorts of things, okay? Now, a separation doesn't mean that you can't exercise. It means you simply have to modify the types of exercises that you're doing, okay? For some of us, it will mean that we always have a slight gap. I've got a 2 centimetre finger gap, but it is a high functioning gap, which with assessment, you'd be able to tell whether you have one of those, okay? So if there is strength in the midline, a gap there is okay, all right? So there's ways of assessing whether that separation will have an impact on your general health or not, okay? What can a gap in your abdominals lead to? Why should it be something we consider? Well, it can signify a weakness in the abdominals, and that can lead to muscle weakness in your back as well, which can lead to particularly lower back pain, but back pain all the way down the spine. It can also lead to pelvic floor dysfunction, okay? So there's a real correlation between the tummy separation and pelvic floor dysfunction. All of these muscles work in synergy. They work together. They don't work in isolation. We are part of one big package, okay? So where there's a weakness in one area, it might feed to a weakness in another, which is why we need to address it. Okay, so a tummy separation is not something to be afraid of or ashamed of or worried about, but it is something to be aware of and to investigate, okay? So if you're not sure whether you have a tummy separation or not, do be in touch with me and I can take you through a self-examination so we can work out whether there's a separation there. And we can also assess whether you need to have any specialist care and help from a women's health physio, or whether we can provide some exercise for you to do yourself, okay? So they're really important things to take into consideration. So moving on from those main points, when I get a new client, I assess each client and through a series of questions, and I just want to share a few of those questions with you. This is for postnatal specific exercise, and this is when they'll join me after the 6th week after a vaginal birth or a 10 to 12 week C-section. This is just a few, this is just a selection, okay? But it's a kind of depth that we need to understand, and I'm using them to show you that they are common questions for all mums and they're important for us all to consider, okay? Whether our baby's 6 weeks, 6 months, whether you've started to exercise straight away or whether you've left it a few months, okay? All important. So let me just share a few with you. Do you lose urinary control when you are laughing, sneezing, coughing, or jumping or moving quickly? Okay, so as well as the not being able to make it to the toilet in time, feeling real pressure, how do your muscles react under pressure? Okay, so if you are on the trampoline, is it something you've tried and you're like, gosh, I can't do that anymore? When you sneeze, do you worry that you're going to wee yourself a little bit? Okay, so think about that. If the answer is yes, you do lose urinary control, you do need to modify your exercise regime, and I can help you with suggestions on how to do that, okay? So another question, are you experiencing difficulty with your bowel, wind, or urinary urges? So this is the issue to do with, can you get to the toilet in time? Are you worried about being caught short, okay? And as you'll have heard in the question, it applies to wee, poo and wind, all right? You want to make sure that you feel comfortable being in a public area and you can control those bodily functions, okay? It's not something you just have to accept as being part of being a mum, okay? Do you experience a sensation of pressure in your vagina or rectum, or have you noticed any protrusions from your orifices? Has anyone ever said you may have a prolapse? Okay, so you may have seen a GP that did examine you. So these are all signs of a prolapse when the pelvic organs fall through, as I talked about earlier. Definitely needs addressing, should not be ignored, okay? It would feel quite uncomfortable, all right? So please ask me about those if you have that issue. Do you experience pain inside or at the joints in your pelvis? Okay, that can also be a sign that there's some issues with your pelvic organs there. Do you have separation of your abdominal muscles at the midline, as we discussed? And do you have a history of low back pain or any other type of back pain? All right, so if you're thinking, yeah, a couple of those apply to me, I don't feel quite right down there, please be in touch with me, either through my email, which is familyfitnessuk@gmail.com, or through my Facebook, Nicola Ostler Fitness Coach, or my Instagram is also Nicola Ostler Fitness Coach. Okay, so be in touch with me, or if you want to skip right to your GP, go back to them, describe your issue, and if you need to, ask to be referred to a women's health physio if it's not offered, okay? That's who you need to see. All right, thank you so much for listening, and again, please do be in touch if I can help you with anything.